Hello all, and welcome to the Sarah Alert Learning Hour. My name is Danny McLean, and I'm on the Sarah Alert communication team. And on behalf of all of my colleagues, we're very excited to talk to you today about Sarah Alert. Today, we're going to discuss Sarah Alert's impact to date, how it was built by public health for public health, how it was designed to be an accessible and inclusive tool that respects the privacy of its users, and its ability to interoperate with many public health systems and its potential future use. We'd like for this to be as interactive as possible, so please feel free to use that chat box and enter any questions you have for the panel, and we will address them throughout the session. Please also note that we will be recording the session for you all to consume later. I want to first introduce our esteemed panelists from Virginia who have been early adopters and avid users of Sarah Alert. Rebecca Early is an epidemiologist lead for the Division of Informatics and Information Systems with the Virginia Department of Health. She provides strategic oversight for agency-wide and statewide information systems, including the Virginia Electronic Disease Surveillance System, VEDS, which is for reportable disease surveillance, and Sarah Alert, which you'll hear about today. Thank you so much for joining us today, Rebecca. Amy Simmons is a public health nurse with the Fairfax County Health Department in Virginia. In 2018, Amy was recognized as Fairfax County Nurse of the Year, and in June 2020, Amy stood up the monitoring arm of the containment branch as a manager of the Sarah Alert Wellness Team. Amy, thank you for joining us today as well. Next, I'd like to introduce the three Sarah Alert teammates that you'll be hearing from today. Kelly Hay is Sarah Alert's product owner and an epidemiologist with expertise in applied public health and informatics. She has a passion for improving the nation's public health and the systems that support it. Kelly, welcome. Adam Holmes is the Sarah Alert technical lead. He oversees the software design, implementation, and delivery of the Sarah Alert application. He has experience in building robust and reliable web-based software applications, as well as standards development in health IT. Adam, great to have you here. Last and certainly but not least is Dr. Paul Jarris. He is the Chief Medical Advisor for MITRE and has led the Sarah Alert initiative since its inception. Paul is a national leader in public and population health, health policy, health equity, wellness, and health promotion. Paul, thank you for being here. To set the stage, we're going to play you a short video on Sarah Alert that goes over what it is, how it works, and why it matters. Roll the video, please.
Public health officials are the first line of defense against disease outbreaks. MITRE, a not-for-profit company working in the public interest, partnered with the public health community to develop Sarah Alert. Sarah Alert is a tool that allows public health departments to support people exposed to or sick with an infectious disease like COVID-19. It also allows those affected to report their symptoms so public health officials can monitor and make informed decisions. During an outbreak, public health departments must identify people who are sick with the disease and anyone they have exposed to the disease by coming in close contact with them. This can take a great deal of time and manpower. Many public health departments are already stretched thin, even before an infectious disease outbreak. Now more than ever, health departments need modern systems like Sarah Alert to respond to disease outbreaks like COVID-19. When a person in the community has been exposed to a disease or becomes sick with the disease, the health department will contact that person and enroll them or their household in Sarah Alert, where they can be followed daily for symptoms. The person simply enters their symptoms each day via web, text, email, or phone. The information is stored and protected in a database that can only be seen by their local or state health department. People who are sick with the disease will be placed in isolation at home where their symptoms will be followed daily until they are fully recovered. Once they are recovered, all their information is deleted from Sarah Alert. For people who are exposed to the disease but do not show symptoms, Sarah Alert follows them while they are in quarantine for 14 days. If they develop symptoms, Sarah Alert allows public health professionals to reach out quickly and arrange for the testing and care they need. Sarah Alert provides real-time insights into the outbreak and spread of an infectious disease in a community to better decide how to provide the best help to the people living there. If the number of COVID-19 cases are low in your community, your health department can keep you safe by using Sarah Alert to help contain the disease early. As social distancing measures are relaxed, your health department can keep your community safe by using Sarah Alert to help control a rebound of the virus. When global infectious disease outbreaks and pandemics like COVID-19 threaten the health of our nation, Sarah Alert is designed to help your public health department protect you and your community. To find out more information about Sarah Alert, visit us on the web at www.sarahalert.org.
So now that you know a little bit about what Sarah Alert is and what it does, we're going to get into it a little bit more throughout this hour with our panelists. And first, we're going to turn it over to Kelly Hay, who I said earlier was the Sarah Alert product owner, and she's going to tell you about the origins of Sarah Alert and the impact it's had to the state. Turn over to you, Kelly.
Great, thanks, Danny. Right, as Danny said, I'd like to first set the foundation of Sarah Alert journey, where we started, some of the high-level results and impact that we've seen. And then we're going to turn it over to Rebecca and Amy to reflect on their respective journeys at the state and local level. As the video alluded to, in early 2020, we had an opportunity to develop Sarah Alert in response to early reports of COVID-19. And based on our team's experience with previous large-scale events like traveler monitoring for Ebola, H1N1, SARS, we knew that if COVID-19 spread in the US, that our public health resources would be stretched thin, and that there was an opportunity to create a system that would serve as a force multiplier to help optimize the use of our limited public health resources. So you can see here, like the high-level case investigation workflow, where you start with a case investigation, there's contact tracing involved. In the cases, you follow through isolation, and the contacts you follow through quarantine. And we wanted to analyze this high-level workflow and identify the aspect of the workflow that was ripe for automation, so we could easily imagine technology helping public health with that part of the workflow without changing how public health responds. And case investigation and contact tracing involves, it requires a skill set of trained public health professionals to follow up. So whenever we looked at this workflow, the piece that we identified was that daily follow-up, whether with cases through isolation or with contacts through quarantine. And again, it was ripe for automation because it's a repetitive task. There's a high burden on public health to do those daily touch points. And that basic solicitation of, hey, how are you doing today? Doesn't require a lot of skill, and public health resources could be better used in the case investigation and contact tracing aspects of the workflow. So from the very beginning, when we were imagining what this tool could be to support public health, we came up with some core tenets that have driven how the system has been developed. And I think Rebecca and Amy will touch on some of the impacts of these early decisions that we made during this session. So first was that this would be a standards-based and open source tool. The system would be made configurable to support monitoring of different diseases of public health interest. So although our first test of this system has been COVID-19, it's not designed to be a COVID-19 tool. It's designed to be configurable for various public health conditions or diseases of concern. Partnership with public health is integral to our system design and maturity. It's really a part of the DNA of this project, and has led to the impact that we've been able to share with our partners. The system would be cloud-based, which means it's accessible without requiring the installation of any software. And it also would be secure and scalable. So security, of course, is paramount to ensure we can maintain the trust of our public health partners, as well as the public that we're engaging with. And it must be scalable to support different response sizes. So from local outbreaks to a large-scale pandemic response. Sarah Alert was launched about a year ago, so you can see some numbers here that highlight our journey and the impact that we've had so far. The system has been used by over 10,000 public health users to monitor over 3 million individuals across a diverse set of jurisdictions at the state, territorial, local, and tribal levels. You can see we currently have over 200,000 individuals that are being monitored using SareAlert, and we have over 6,000 active users, and we're happy to have Amy and Rebecca, two of those active users, here today. So without further ado, Danny, I'll turn it over to you for our panelists.
Yeah, absolutely. So I would like to start with Rebecca. And at the Virginia Department of Health level, kind of that state level, Virginia was an early adopter of SareAlert. What was your experience in those early days like, and what kind of impact has SareAlert had for the state of Virginia? Rebecca, can you hear us? I think you're on mute. Rebecca, can you hear us?
Yes, I just had connectivity drop, so I'm sorry, I had to come back in. Have you already asked the first question?
Yes, sorry. And this wouldn't be a COVID related preparedness response without a little bit of technical difficulties. We're very on theme right now. But thank you so much for joining us, Rebecca. We really appreciate it. So the first question is to you, Rebecca. And so from the state of Virginia level, Virginia was an early adopter of SareAlert. And so I just want to know what was your experience like in those early days, and what kind of impact has it had for your state?
Sure. We were an early adopter. We actually went live with the system on 5/29/20. We were originally using a REDCap application, and SareAlert was really attractive to us, and still is for many of the reasons Kelly just went over. It really takes the burden off our contact tracing community. It automates those daily check-ins. It logs the notifications for symptom monitoring, and that was really attractive to us. So we spent some weeks really getting familiar with the application, developing some Virginia-specific workflows based on how the application worked. Made use of the MITRE materials. Those were accelerators for us in terms of quick start guides and user guides, and then again, adapted to some of what Virginia was looking for. So we started with 0 users, and then we're now at something like 2,500 users. So a huge increase there in terms of our user community. So we make use of the MITRE webpage, as well as we have a SareAlert Virginia webpage where we have some of our workflow materials. But it was a great partnership. We had early on a lot of engagement with MITRE. We have a deployment manager who spent a lot of time with us. We had bi-weekly meetings with MITRE to get the application off the ground, to get the Virginia workflows off the ground, and that was super useful. But just the impact just early on was this intuitive workflows, taking some of that daily workflow, or daily, I should say, notifications off us, to really allow them to concentrate on education on quarantine, wraparound services, really to make an impact on what we're looking for, which was halting disease spread, because we're doing this education about quarantine and people we're getting such an impact with regard to the number of people that are monitoring. So it was a great experience, a real time saver for us. And then, with regard to, there were a few gaps kind of early on in terms of, we wanted a Spanish translation, and MITRE has been super committed to continuous quality improvement to really kind of respond to those needs and make those changes. And so it's been a great experience.
That's excellent. Thank you so much, Rebecca. And same question to you, Amy, from the Fairfax County kind of local level. Kind of when did you all get involved with SareAlert, and kind of what kind of impact has that had for you all?
Sure. Happy to talk about those early days. I honestly remember that day very well when I was first introduced to SareAlert, June 10th, 2020. On our first day on our response using SareAlert, we had 45 enrollees. I'm kind of nostalgic for that time when I knew them all by name. We had 6 cases and 39 contacts. It was new to all of us. We were learning the program. We were also learning, our way with COVID response. So I really felt that SareAlert was there for us. So not only providing, MITRE is a not-for-profit, providing this for jurisdictions to use at no cost. It was really amazing for us. So we appreciate that partnership, that term partnership. You'll hear it throughout the hour. I'm sure we really feel that strong partnership. So as we were learning about SareAlerts, all the different things that came along with that, the trainings, the user guides, the things that were there for us right from the beginning as we were learning. It's very user-friendly. It's very intuitive. for not only the monitoree who's putting in their symptoms, but for all of us who are using it on this end. So it was a I would say an exciting and engaging early process of learning about those early days. There's a lot of anxiety about COVID, especially at the beginning when there was so much unknown. So having those case and contact interviews, those conversations with the community, not stop with that conversation that when they're giving the guidance, and to know that the conversation will continue, the checking in will continue during isolation and quarantine. That is really a beauty of Sarah Alert, enabling us to continue their journey with COVID during that anxious time. I can talk a little bit more about how it impacted our monitoring, but those were what my memories of the early days for sure back in June.
Oh, that's great. Thank you so much, Amy. And to come back to Rebecca for a second. So, you know, I think we've heard, you know, some anecdotal kind of things of how that really has helped your operation and how you all have been involved kind of very early on. But, you know, for the quants in the audience, could you provide, you know, some statistics, some numbers of kind of how Sarah Alert has provided impact kind of, you know, across, you know, your jurisdictions? We'll start with Rebecca.
Mm-hmm.
So I think both Amy and I can speak to the fact that, again, the intuitive line list, the taking the burden off the contact tracing community to focus on the dialogue, to focus on the education. Statewide, there's been more than 246,000 monitorees that have been enrolled in the application. That is huge. More than 93% of the individuals enrolled in Sarah Alert have had an initial assessment or interview, and over 83% are interviewed within the first 24 hours of being identified by a case and enrolled in Sarah Alert. So that's huge. That's a huge number, very impressive. And from my perspective, we could only do it using Sarah Alert to have these kind of statistics of a 93% interview and an 83% interviewed within enrollment within Sarah Alert, because those cues I think are just so intuitive to see this is someone who's the new enrollee, we need to contact them. And I think that just makes such a huge impact, because that initial conversation is so important to talk about infection control and quarantine and wraparound services, so that they know that they're supported if they have any quarantine challenges. The average number of days of monitoring for reports is 8.7, so almost 9, with an average number of days eligible for monitoring at 11. So there is a few days gap in between, right, their last date of exposure, when they're named by a case, when they're interviewed, and then when they're actually enrolled into Sarah Alert. But I think that's very impressive. That's 9 out of 11 days on average that we're getting reports from our contacts, which is great. We did look at a 2-month sample between November 1st and 12/31/2020 to look at some of the statistics on monitorees. If you're interested in kind of what method they chose, because as we know, Sarah Alert, one of the beauties of Sarah Alert is this flexibility of providing different methods of communicating and providing that self-monitoring information, as well as different times. And that's great in terms of, you know, people's comfort levels with technology, people's, you know, whether they're a night owl or a morning person. So when we looked at that data, 76% of monitorees actually chose text message, which I think really underlines kind of the ease of use. Everybody texts now, and it's so easy to respond to a text. And I think that is, again, one of the beauties of Sarah Alert is text messaging is available. So 76% chose text messaging, followed by email at 8% and phone at about 5%. About 5% of people opt out, and some are contacted manually. So they're enrolled in the system, but maybe they want someone to, you know, physically call them. They want to hear somebody on the other end of the line. And the application is flexible enough so that if you want to do that, you can. And you're still in the application, maybe your notifications are paused, but a nurse epi or other contact tracer can reach out. So it has that flexibility. 51% chose morning, 28% chose afternoon, another 9% chose evening. So it just underlines the flexibility of when folks can actually respond. We have also looked at the monitoring information in terms of demographics, but we haven't yet compared that with regard to, for example, the Virginia population. So I can provide some of those, but can't yet comment on kind of how representative that is. But I think from our perspective, a huge impact, and I think very impressive because it really allows us to reach a high number of individuals in a short amount of time.
Yeah, that's a lot of very impressive numbers. I mean, 246,000 people, 93% interview completion rate, and just the sheer, volume over the last year, just, hard to really identify that impact, but that has touched at least a couple 100,000 people's lives. This is incredible. And I would really like to give everybody kind of a opportunity, invitation to use this chat function. If any of the things that we're saying, any of the numbers you'd like a little bit more clarification on, please feel free to use that chat function. We'd like this to be a little bit more of a free flowing discussion. So thank you so much for sharing all that with us, Rebecca. So Amy, do you have kind of a couple of numbers from the Fairfax County realm? I know that Rebecca did provide a whole bunch, but I know that Fairfax County has been doing some great work as well.
Yeah, thanks for asking. We my comments will obviously mirror Rebecca's because it's understandably our success is similar in that it's all about being able to meet and connect with this many people in our community. So again, mirroring that sheer volume of monitorees is the true success. It's been an important part of our monitoring tool and our box it in strategy. So out of our 1.2 million Fairfax residents, we have enrolled 96,764 to date in our SARA alerts. Our daily average has been over 2,600, with about 60% of those being contacts. I know one thing I often receive a question about is that, percentage of reporting. And I do remember that first day when I was tasked with standing up this monitoring team. I was curious and also concerned how many people were actually going to respond, like how successful could this be? But was since day one very pleasantly surprised. So our best day ever was 88% reporting. And I just want to say, looking back in the past 2 months, I can give you some data from that. Even in this time of a bit of pandemic fatigue, we're still seeing that people are reporting. So we had 73% of our contacts reporting daily and 84% of our cases reporting. It seems that it has always been that trend that those cases, those in isolation, are a higher percentage of reporting than our contacts. But as I mentioned, this has been the ability to reach everybody, allows us to be efficient and targeted in our outreach. Using the SARA alerts, we know who we need to call when they're ending isolation. We know when contacts become symptomatic. Also calling those non-reporters. And there's all kinds of reasons we know that people will be reporting and then stop reporting, and getting them back in the fold, checking in how they're doing. Occasionally, we've even had a few situations where we've had to call emergency response on someone who hasn't reported. They've been transported, and you never know, that call, because of SARA, could have been a life-saving intervention. So again, grateful for the tool just to be able to reach the numbers that we have.
No, that's great. Yeah, thank you so much, Amy. And so let's move on to the next topic. So now that everybody gets a sense of kind of what the tool is and the kind of impact that it's had for a jurisdiction like Virginia, let's talk about kind of how it was built and kind of what some of the kind of core tenets were, and kind of how this whole thing kind of got put together. So back over to you, Kelly.
Yeah, thanks, Danny. So I mentioned in the intro that partnership with public health has really been a part of the DNA of this project. And we like to say that SARA Alert has been designed with public health for public health. So what do we mean by that when we say that? So from the beginning, we knew that the individuals best suited to tell us what the system needed to do were those doing the work. As a prior field epi, I would have appreciated, that same opportunity. So it's an opportunity to pay that back. And we've been able to engage with a wide variety of public health professionals, and you can see the organizations that individuals have come from: federal, local, state, tribal, public health organizations, professional public health associations, nonprofits, research organizations. We've been able to engage with our principal partners, NACCHO, APHL, ASTO, CSDE, CDC Foundation, and CDC from the very beginning, before this was even in production. We were able to go around and get all of these different perspectives that said, if you could dream big, I remember talking to a former colleague, if you could dream big, what would you want to see? And it was like, what do you mean, can I dream big? And it was like, no, that's really what we want to hear. And we can't promise we can deliver everything as quickly as we'd like, but we would love to listen and figure out a path towards success. So all of our partners have helped provide feedback, identify those requirements, the vision, the roadmap for SareAlert. And then we've worked with all of our partners to figure out, with that wish list, that dream big list that we have, what's going to give us the most value and most return on investment immediately. And let's try to get those out to production as soon as we can. And then those things that are nice to have, we'll come back to them whenever we have resources, but let's focus on what do you need right now to support your job in the field. So as part of that, that sounds pretty high level, but how have we enacted that into our software development lifecycle? So shown here is a basic software development lifecycle. And what I've done is map the different engagement activities that we run to each of those phases of the software development lifecycle. So for instance, for the plan, design, and develop, so that whole part where you're figuring out what the system should actually be doing, we engage during a bi-weekly feature review. Once upon a time, it was weekly. Our panelists probably remember that, but we've been able to cool it down to every other week. But that's an opportunity to talk about what are the priorities. Of the priorities that have been identified, here are some ideas of how this could work. And we do polling during those feature reviews to say, if there's option A, B, or C, what's your preference? Is there anything we haven't thought about? What are we missing? So we're able to have those conversations. Partner News is a weekly opportunity where stakeholders, both current users, prospective users, anyone that's interested in the system can come and get a touch point on what's new. But also I think one of the greatest pieces of Partner News is sharing of experiences. And I know Amy and Rebecca have come on to Partner News and shared their experiences, but we've had a wide variety of jurisdictions share with the SareAlert community how they're using it. And we've had really robust conversations about different use cases, because every jurisdiction is a little bit different. So there's a lot to learn there and how you can implement SareAlert flexibly. We provide demonstrations on new features. We have a user forum that's hosted by NACCHO, so it's an asynchronous way to connect with others, because we know time demands are very high right now, and it's hard to always come to a meeting like feature review or Partner News. So the user forum was set up so people can come together and discuss things as needed. So we have that engagement going on through that entire planning piece. And then once we develop the software, and Adam's team can talk to that, we do user acceptance testing. So that's when we say, we think we got this right based on what we heard, but it's an opportunity for users to log into our test system and actually navigate through the system, press the different buttons so they can really get the look and feel of the feature. And oftentimes we get a lot of great feedback on, if you just tweak that, that would make a lot more sense to us. It would be more intuitive. Have you thought about this? And we're able to roll that into the future improvements. And then for the deployment phase, so we do bi-weekly releases. We're actually coming up on the 27th release next Tuesday. So we've been putting out 2 releases a month. So part of that continuous quality improvement is every 2 weeks, understanding what the needs are and, again, rapidly deploying them to production. We have user office hours where different jurisdictions are able to come together and, again, have a common platform where they can ask questions and learn from each other. So we're able to make that connection, but we're also able to demonstrate what's new in the system. So we can walk through, this is what the final feature looks like. And if there's any questions, we're able to help the jurisdictions there. We have on-demand training videos. So we're partnering with ASTO to create interactive training videos, but in the interim, we have videos posted on YouTube because who wants to read a really long user guide? It's great to be there, but the videos are to help support the users. Listed the user forum there again, and I know Rebecca mentioned this earlier, but we also have our user guides and quick start guides, which we've actually added new sections or new quick start guides based on requests from the jurisdiction. So if there's, questions about household reporting or, the different reporting methods, we create those quick start guides whenever we know there's that need for specific user documentation, again, to support our users. So we are engaged with our partners every step of the way in the development of the product.
Thank you very much, Kelly. So let's kick this over to Rebecca and Amy again. I'll start with Amy first. And so what has your experience, Amy, been like through this entire process, and going through feature reviews and user acceptance testing and other activities? Kind of give us a sense of kind of what it's been like.
Yeah, it's been great. I mean, we're very grateful to be in this Agile project and the ongoing conversations. I mean, we're also lucky to have a state office with Rebecca that allows us to be part of that conversation directly with MITRE. My team and myself, we've been involved. As you heard, we did present on the partner news connection, but we also are part of that weekly work group. My team joins those office hours and learns things both at the state and the one that MITRE provides. So the every 2-week enhancements, I have to say, creates kind of a buzz for us on our team that are working in SARA. So it is hard to believe it's already been 26 versions have been rolled out. But every 2 weeks, not only those enhancements, but you get the information leading up, what will be included. And then you get the email, you get the user guide update, you get the quick start guides that might be associated with it. So there's a lot of support with that ongoing training. Last week, the big excitement on my morning huddle was, did everybody see the new icon, with it showing symptomatic in the line list? So it's really like, it's engaging. It's so fun and exciting to be part of the conversations, sharing information with the developers in the meetings that we have. So very grateful. I just want to say that. And it's, we've seen the SARA alerts grow quite a lot in various enhancements in the time that we've been working with the tool.
Thank you, Amy. I'm sure from people from Kelly's team would just love the mental image of like a group of EPIs sitting around their computer screens with bated breath, waiting for that weekly email, that's what gets you going in the morning. Rebecca, how about you? What has been your experience throughout this process?
Absolutely. I liked what Kelly said about designed for public health by public health, and you can tell, absolutely. There are so many features, I think, within SARA Alert that are just really intuitive and make a lot of sense because I feel like we've been heard. And as Kelly said, she did involve a lot of different public health entities. So some of the features, again, the intuitive line list, the bulk features that may not be available in other applications are just fantastic. And so I feel with regard to this process, we've been heard. That is so important. And the level of engagement. So I mentioned that we had weeks leading up to our go live, and then we went live, and we had our development deployment manager. We had bi-weekly or twice weekly, I should say, meetings with our deployment manager to talk about, what are our questions? What are our enhancement suggestions? How does this work? And that was so crucial and so important and so valuable. And so I really appreciated that. That engagement, that partnership. So twice a week, we had our deployment manager talk with us, and they're now weekly. You guys had put out, as you mentioned, an application or release every month. That is, compared to other applications, that is super ambitious. super aggressive and really appreciated, because every time you release something new, as Amy mentioned, there's a new feature that helps their workflow, that creates efficiencies. And so we're so appreciative. So, but it's been a valuable process. It's been an engaging process. The feature review, the user acceptance testing, as Kelly mentioned, to have the developer's ear, to learn more about new features and to provide feedback as that new feature is being developed. So it may not have been finalized, and we can just kind of tweak it before it's actually released. That is, from my perspective, has been, priceless. And then MITRE's also shared a roadmap with us in terms of kind of where they are and where they're going, and that's also been impactful and important to be engaged in terms of kind of where our enhancements or our vision, as well as MITRE's vision in terms of going forward. So yeah.
Thank you so
Thank
much,
you.
Rebecca. And I'm going to drop that link for the roadmap into the Q&A right now, in case you want to kind of see what that looks like from our Trello that is used to manage that roadmap. So thank you very much. So let's go to another topic that is really, really important, especially now, on accessibility. So let me kick that back over to Kelly.
Yeah, thanks, Danny. So from the beginning, some of the core tenets we talked about, security and scalability, but accessibility was another one of these core tenets. And we wanted the tool to be as accessible to all communities as it could be. And we understand that accessibility, it's a journey, it's not a destination. So although the tool is 508 compliant, we do continually roll out updates to improve the experience for both our users and for the public. So we've done this through a couple different modes that you can see highlighted here. So intentional design. So I know Rebecca and Amy alluded to this, but trying to have a clean user interface that's intuitive to the public health workforce. Also clean design for monitorees. So it's very, it's not a complicated process. You don't have to download anything. The options that were alluded to earlier. So you can get a text message, an email, or an automated phone call. And this ensures that individuals that don't have broadband access or don't have a smartphone or even don't have a cell phone are able to participate in SareAlert and have that connection to public health. So we know, about 20% of the total population, 50% of people over 65, and a substantial number of people in underserved communities do not have smartphones. So it was really important for us from the beginning to provide access to as many folks as possible. Privacy and security, so we talked about this early on, but if you don't have the trust of the community, they're not going to participate in any sort of active monitoring, which we want to help prevent the spread of disease throughout the community. So privacy and security has been a hallmark from the very beginning. We collect the minimal amount of information that our public health partners tell us they need to help effectively conduct active monitoring. The information is encrypted, it's handled in a secured environment with strict access controls, two-factor authentication, and the data is actually purged from our database shortly after the monitoring period ends. So this allows the data to stay with the state and local jurisdictions in their domain, and it isn't kept in the database for long term. Language, this was alluded to earlier, but our tool and supporting materials are available in multiple languages. So we currently support English, Spanish, Puerto Rican Spanish, French, and Somali, and are looking to adapt and adopt new languages over this summer to be able to expand that based on the needs that we've heard. And then usability in plain language. So we have experts on our team that have gone through our user documentation, the website, and applied that to improve the accessibility of our documentation. We've applied health literacy, usability, and human-centered design best practices to the tool as well, just to provide that overall positive experience and increase accessibility as much as possible.
Excellent, thank you, Kelly. So let's start with Rebecca. So how has SareAlert helped Virginia serve? How has SareAlert helped Virginia serve your populations?
Absolutely. So as Kelly was mentioning, it provides a wide variety of reporting options, and those are key to its flexibility and comfort in terms of people's comfort level with technology, either geographically or generationally. As she mentioned, some do not have wide coverage, so maybe they prefer a phone call versus a text message. In addition, the ability to choose when you're actually going to be contacted. The number of languages has been extremely useful, and those have increased over time and are really key to making sure that our populations are served across the Commonwealth, all populations. So those have really been key. Um, and because I'm at the state level, I also want to include, I know you're going to call on Amy, but I think she has a little better insight in terms of impact on Fairfax. So I would like to hear her response as well. I know you were going to call on her, but I know she's boots on the ground, so I know she's seeing that impact in Fairfax.
Couldn't have had a better transition myself, Amy.
Thank you both. So yeah, I think there are a few areas I'd like to talk about that accessibility. The first being language, and we are 30% foreign-born in Fairfax. We need a robust system to interact with those members in our community. I remember very well, it was the second week that we were using Sarah Alerts when the Spanish notifications rolled out. Huge difference right away, being able to bring all of those folks in the fold to use Spanish directly for the request for symptom reports. Also, all of the languages that have been added on the drop-down list so that we can quickly look when we're looking at a monitoree's profile, what language they need for us to utilize in order to connect with them when we're calling them. So that helps us to prioritize our translation services and connect with our community. We have made over 104,000 calls on our team since June. 17,000 of those needed to be utilizing some language support. So that gives you an idea why it's so helpful to have Sarah Alert prioritize for us who we need what language for. So that's great. And Sarah, the way the workflows and the profile shows the language, it helps us to know right away what we need to do. Another area for accessibility is just this ease of use by the end user. And that ability, as we've talked about, how flexible, how adaptable it is. So someone may start out with a method of reporting for email and then decide life's too hectic doing virtual school and work at home and I can't stand another email. How about you just give me a call? So we have ourselves changed monitoring plans, methods of reporting over 2,000 times for different residents. And that makes it more accessible, right? Meeting people where they're at. There's a lot to juggle when you're quarantining, if you're not feeling well, isolating. So being able to make that more accessible, the time of day, the type of reporting we're asking of them. And then the last thing, which may seem like an odd thing to talk about with accessibility, but it's that trust factor, is the name, Sarah. I remember listening to Dr. Jarris speak in the trainings when we were first onboarding about how the decision to come up with the name Sarah. And I have to say, from my perspective, it really seems like it is working. I've overheard people in the grocery store talking about Sarah Alerts. I tried to keep my physical distance and listen in to what they were saying. But we get emails, we get phone calls, people saying, hey, Sarah, I know you're looking, you wanted to know about my symptoms. I mean, literally the name is working. We're trying to, as Kelly mentioned, think about in this time of people concerned about privacy, we're trying to build that trust. So I think of our reaching out with Sarah. It's not Big Brother watching you. It's like Sarah looking out for you. It's Sarah reaching out, wanting to know how you're doing. Quarantining is not easy. Isolating is not easy if you're not feeling well on top of that. So having this connection. If it's okay, just a quick story. I know, people, we have memorable moments on our wellness team, Sarah Alerts, and people have all kinds of stories, but one person in particular, I remember she was expressing her gratitude for checking in through the texts and then the phone calls. And she said this was the first time she felt American. She was a foreign-born We used language services, and then she had mentioned that. So it just showed like we had actually through Sarah Alert been able to make that connection with her in a really powerful way.
That is really powerful. Thank you for sharing that, Amy. That's incredible.
Sure.
Dr. Jarris, do you want to get in here and provide some perspective?
Yeah, I'm really enjoying Amy and Rebecca. Thank you so much for the comments. There's a couple of things I wanted to reiterate that Kelly touched on. You know, in public health, we care for everybody, but we have a particular responsibility for those who are most vulnerable. And that's why it is so important that we built Sarah Alert the way we did, and that it can call a landline, so that you don't have to be one of those people who have, you know, large parts of our country are beyond cell phone and broadband. And we wanted to be able to reach out to frontier locations, Native American locations, and others in that, other than that, and we were able to. Another thing we learned is that on some of the Native American lands, in some of the US territories, people don't have a physical location for their address, unlike those of us who live in 911 areas do. So we can work around that and work with people who don't have that physical address. Another thing was the group reporting or household reporting, so that if you're a migrant worker or if you're in a multi-generational or even multi-family household, you can report in on behalf of other people who may not have the capacity to report in. So we've taken those types of things, you know, into account in many ways, and I'm sure there's more that we can learn. The other thing in terms that we've done in terms of the system and the acceptability is we have an incredible communications team that monitors media, including social media. And we're able to find if a comment is made, for example, in a given jurisdiction that health agency should know about. So perhaps they can alter their messaging, or there's a particular concern that they would need to know about. And believe it or not, and I guess it's not hard to believe in this environment, at one point we even found a death threat. And able to go to the sheriff in that location as well as the health agency and let them know, and the sheriff made a visit to the individual. Because we wanted to keep the people safe. Unfortunately, we are in that type of environment. Two other things that we decided early on. One was we did not want to have a tool that was download. People had to download onto their phone, because we didn't think foreign nationals and many people in this country would want to download a government app onto their phone. And we very specifically made a decision not to track location as many other tools do, because we do not want people worrying about is the government tracking their location. So we've tried it at every way in every way to do that. Now, in some cases, those prove later to be limitations, but we thought the most important thing was the security and the privacy. And I'll tell you, one of the limitations we ran into is, again, due to a real concern about security and privacy, we made a decision that 2 weeks after a case is closed, that data will be offered to the jurisdiction to download into their systems, but will be purged from Sarah Alert. So when we have researchers come to us and say, oh, you know, we would love to have this data to research, we say, tool's not designed for that. First of all, it's the jurisdiction's data. We don't have access to the data. And secondly, we can't do it. So it cuts both ways, but really we've tried to put everything we can into that security and privacy.
Thank you so much, Dr. Jarris, for that. That's a really good insight. I want to make sure that we get to this kind of final piece that we have on interoperability and sustainability. And with that, I'd like to introduce the Sarah Alert technical lead, Adam Holmes. Take it away, Adam.
All right, thanks, Danny. So next slide, please. So interoperability really is essential to the success and usefulness of any system, and Sarah Alert is no exception. So from the beginning, we wanted Sarah Alert to fit in well with the system of systems that make up the process of handling disease outbreaks, and made sure to bake in interoperability from the very beginning, rather than trying to bolt it on as an afterthought. And since then, we've made a concerted effort to continue to improve Sarah Alert's ability to integrate with other systems as additional use cases came up. So the keystone of that effort, I believe, is the Sarah Alert FHIR API. So if you're not familiar with FHIR, FHIR stands for Fast Healthcare Interoperability Resources, and it is an open standard adopted by the HL7 International Healthcare Standards Organization, which describes the data representation and methods required for healthcare systems to exchange data. It's based on modern web practices and standards and has a very low barrier of entry for developers to learn and implement against, particularly compared to some of the other common healthcare standards. We've defined a FHIR IG and implementation guide that describes how to use our FHIR API, which we share with our users who are interested in utilizing it. And it is actually now being used in our production environment successfully. Additionally, we support exporting the NBS PHDC format. So PHDC is the public health document container. That is a CDA document, clinical document architecture, lots of acronyms, which is another HL7 standard for importing data from SaraLert into NBS. And beyond that, we have a standard Excel-based format for importing data for those users who prefer that method, as well as the ability to actually customize data exports with the exact data elements and fields that you want. Next slide, please. And the other important part of this is sustainability. So it's really important to know that SaraLert is not a COVID-specific application, and we designed it specifically so that it will be useful for other applications and use cases, as well as useful in the future. It's open source. The software is licensed under a commercially friendly open source license. So not only are folks free to go download the software online and stand it up, commercial entities can also take it and integrate it within their own products if they so choose. The specific license, if you're curious, that SaraLert is registered under is the Apache 2.0 license. The entire code base and everything a technical team needs to stand it up an instance of SaraLert is available publicly online, as I mentioned, on our GitHub repository, which I will paste a link to into chat in a second. It's configurable, as Kelly mentioned. Each instance of SaraLert can be customized for a specific disease. At the moment, that customization is on a per instance basis. However, we're working to allow multiple diseases to be monitored within the same instance. It's scalable and well suited for a variety of deployment environments. Some folks have taken the code and deployed it on local bare metal servers, and others, including ourselves, have deployed it to cloud environments. In our case, in particular, the AWS environment from Amazon. It utilizes containerization technology and is architected in a way that makes it very easy to quickly and add capacity if demand increases. It's maintainable. Meaning the technical stack we've chosen is modern, and there are many developers out there in the software industry with experience in our technical stack. So it's very easy to find folks who can quickly start contributing to the code base. Our engineering development process follows very strict guidelines on software quality, security, performance, testing, and many other things. And since this is open source, that entire process is completely public on GitHub. And as I mentioned in the interoperability slide, it's standards-based. As I mentioned previously, we've chosen to utilize from the very beginning FHIR as the keystone of our API. And importantly, our API is not built off of proprietary standards. So our goal is to make it as easy as possible to get data in and out of the system and have that data represented in a way that other systems can actually understand without much effort. Danny?
Excellent. No, thank you so much for that, Adam. And we've been talking a lot about kind of the impact that it's had and how the Virginia jurisdictions have been able to use these for various reasons, and it's been very flexible. But that doesn't happen without this kind of technical wizardry that you and your team have been able to work throughout this whole time. So thank you for going down and breaking out how this can connect with other systems and how this could be potentially used in the future. Could, just for the layman's in the audience that might not be as technically savvy, could you explain what an API is and what it does?
Yeah, absolutely. So an API, that's an acronym that stands for Application Programming Interface. That is essentially a contract, you can think of it, that two different systems will agree on for how to understand how to talk to each other. Additionally, I also would like to mention, in addition to SaraLert being hosted in the AWS environment, it's actually hosted on top of the APHL AIMS platform, if folks are familiar with that.
Excellent. Thank you so much, Adam. So we have 5 more minutes left, and I want to make sure we get to kind of Amy and Rebecca for some final thoughts. But I'd like to kind of hone in on that sustainability piece first. Rebecca, could you kind of can you tell us kind of how Virginia could envision using Sarah Alert in the future with the kind of sustainable framework that Adam has kind of laid out for us?
Yeah, absolutely. So we've considered as an agency using it for Ebola monitoring, and we've been working with MITRE to talk about those requirements for Ebola monitoring. We've also discussed using it in the future for vaccine preventable diseases, things like pertussis or measles. As we've mentioned, it's intuitive. Our user base is familiar with it, and so using those daily notifications to adapt and adjust it to other diseases makes sense for us. And so absolutely we see it as sustainable and a tool we could use potentially in the future for other diseases and emerging diseases. So nobody wants another COVID, but we know that Ebola monitoring has kind of geared up a little bit again. And so there are other diseases on the horizon. So we hope to make use of Sarah Alert.
Yeah, excellent. Thank you. Amy, same question.
Yeah, also similarly, ideally Sarah Alert would be integrated with our VEDS, our reportable disease data system in Virginia, like even as an add-on, working closely in conjunction. I just wanted to make mention, again, feet on the ground. We use that export from Sarah Alerts all the time. It's super easy. It's been 100% reliable for us. We use it for things like getting a workflow for community health outreach, for providing clearance letters. So I just wanted to say that export feature is something that is very easy to use and much appreciated.
Excellent. So for some final thoughts here, I think Amy will stay with you with just this kind of final parting question of, what have you learned from the Sarah Alert partnership that you think others would kind of benefit from hearing, or some just general kind of lessons learned you've had through this experience?
So definitely appreciate and are grateful for the partnership. We've learned a lot along as Sarah Alert has grown and as along our whole COVID response has grown. We would not be able to reach our community in this capacity without a tool like Sarah Alerts, and it allows us to be efficient and to be targeted in our outreach. The Sarah Alert workflows allow us to exactly know at the beginning of each day who are people coming out of isolation that we need to call, and who are those, and this is what I consider like the superpower of Sarah, who are those contacts who are now symptomatic, who were concerned that are now cases. So the way that Sarah Alert, kicks that into our workflow enables us to be efficient about that. And then again, prioritizing our language translation with that. It's user-friendly. It's not only for the person on the other end who's receiving the text or the email, but for all of us who are using it. Because it is web-based, we can have hundreds of people in the system at the same time. It has been without fail, reliable, dependable, and it just, I can't say enough about how much we appreciate the tool and how it has grown as the need has grown as well.
Excellent, thank you, Amy. Same question to you, Rebecca.
I'll make my comments short because I think Amy hit on all the points that I would have mentioned as well, which is I'm glad we chose to use Sarah Alert, and I would recommend other jurisdictions use it as well.
Excellent. And I think that's our time. So unless anyone has any questions online, feel free to put them in while I'm mildly vamping here. But if you want to learn more about Sarah Alert, feel free to go to saralert.org. If you'd like a demo, there is a you could go to saralert.org, /contact us. The GitHub link and the link to Trello is in the chat if you'd like to go back and see those. But we just really appreciate you all taking the time to learn about Sarah Alert for the last hour. And if you're interested, feel free to be in touch with us. But as a last parting thought, I really want to thank Rebecca and Amy again for taking time out of their day from their really important work at their respective health departments to be here with us to talk about Sarah Alert. And to all the panelists, Paul, Kelly and Adam all did such a great job of kind of giving us some essential Sarah Alert information. So thank you very much. We really appreciate your time, and that's going to be it for us. And also reiterate what something Paul was saying is, really thank you to NACCHO too for hosting this. This was a wonderful event, and we're really happy to be participating in it.
Linda?
Hi, Paul.
You want to send out a Teams invite,
Yes, I
or
will.
should we just proceed, you think?
Yeah, I'll go ahead and send one out.
Cool. Thank you, Linda. Thank you, everybody. Talk to you soon.
Thank you.